Hi, welcome back to the new norm. I'm Dr. Lou Graham, and this is brought to you by Midway Dental and Catapult Education. So one of the best things about really being involved with Catapult is I get to meet so many of the wonderful people behind the scenes in dentistry. And when I walk the floor in New York or in Chicago, what really has happened in my life is I get to meet the leaders in these organizations, and leaders can be on multiple levels. So last week I was talking to who I would call one of my good friends in the industry, Colin Rogers, and he is the president of NSK. And I had some really interesting questions, or I thought they were interesting, about aerosol, because aerosol is the big bugaboo in dentistry. I just did my Zoom meeting this week. I've got 7 emergencies coming, how we're gonna alternate rooms. We just have our masks, all our PPE for this week is in. Boom, what are we gonna do? So it gets to aerosols. We will create minor aerosol. It's just gonna happen right now. And this is all emergency-based dentistry. So with that, I was asking Colin some questions, and he said, whoa. As knowledgeable as I am, and he is, he said, you gotta talk to my buddy, Al. Al is the man in the company to talk to. So with that said, I want to bring on his key guy in the company to try to explain these novel approaches NSK has with their handpieces. Born in Iran some years ago, Alfred has really grown up in a world that I can modestly relate to. His dad was a photographer, as my daughter Tess is, but all his uncles were auto mechanics. So he's got this kind of geeky mechanic side to him. And when I've been talking to him over the years, he always talks way over my knowledge level. So Alfred, welcome to the show. I'm just excited to have you here because we're gonna try to explain some aerosol answers that most people don't know about, and I think they're gonna be very surprised. So Alfred, say hello to our group today. Alfred, say hello.
Hi, Dr. Lou. It's an honor to be here in your show. Thank you very much for this opportunity.
It's really our pleasure. So the first thing I want to get into, and we'll get into electrics, is the reverse flow concept and how it really talks about COVID and really how can we minimize, even with standards of cross-contamination within the NSK system. Let's talk about reverse flow and what does this mean in a handpiece and how it affects our patients, or hopefully doesn't affect our patients.
All right.
Okay.
So, as like you said, high and low speed handpieces, when they're used in patient's mouth, they may come in contact with blood and saliva. That makes them subject to contamination. The thing is that when you're dealing with water and high-speed air-driven handpieces, things get even more serious. Just think about it. When you press the foot pedal,
Yep.
there's a flow behind the handpiece.
Yep.
And that's fine. The moment you release the foot pedal, you try to stop the rotation of the burr, but due to the nature of the turbine, the propeller keeps rotating for a minimum a second or two.
Right.
Now, within that short period of time, turbine acts like a pump. It sucks back blood and saliva and foreign particles into the handpiece, into the tubing, to the delivery unit, and into the environment. Now, if you have a contagious virus within that blood and saliva,
Right.
In the absence of a good infection control mechanism inside the handpiece, that can get into the lines. And then when you change the handpiece, you think you have autoclaved it, the handpiece is clean, but still you have that contagious material in the line. It can be a contagion into the next patient.
Okay, so wait a second. Wait. Okay, so let's talk about this. So per my understanding in my discussion with Colin, you have some unique features that minimize that like suck back of the materials. Is that correct? That's what your handpieces have that's unique. Is that correct?
Oh, that's right. And NSK has been working on this system for like over 20 years, much more than 20 years. 1993, they started this mechanism. So let me explain. When we are
Okay.
talking about the suckback flow, there are two ways of infection getting to the handpiece,
Okay.
either through air or water lines. I will start with the reverse flow of the airline. So there are different manufacturers taking different solutions, different approaches to this.
Okay.
Like some manufacturers, what they do, they try to slow down that reverse flow and stop the rotation. So that delay time is always going to be there, right?
Right.
So it's just you're trying to making like 2 seconds versus 1 second. In opposed to that idea, NSK tries to block the reverse flow and divert it back into the patient's mouth. That's what we call a clean head mechanism.
Okay, that's called a clean head mechanism.
That's right.
Okay, so the idea then is the handpiece itself, as it does its suck back for that 1 or 2 seconds or however short, the whatever is going on, that we'll just call it right now, anything that's going on, bacteria, virus, schmutz, that doesn't get sucked down into the lines, that comes out. Is that correct?
That's correct. So in fact, like you said, everything happens within that short period of time, 1 or 2 seconds. You can either let it go within that 2 seconds, that is when you have no infection control, that's the worst case scenario,
Right.
or to reduce it, to reduce the chance, or like I said, with our clean head mechanism, we try to block it and divert it back so it doesn't go into the handpiece and into the line.
Got it. So let me try to understand this. So I think I'm getting this now, Al, in how I see this. So basically, let's just say I've worked on my patient. We turn over the room, handpieces go get autoclaved. Now, that line, technically that line that's in the room, which we flush at the end of the day, that line, technically, with your handpieces, if I'm following this right, should have significantly less cross-contamination from the handpiece in the line, potentially the virus or whatever. Is that correct?
That's correct, and that's perfect way to explain it, especially when you said there is much less chance to get that infection into the lines, because nothing is perfect in this world.
Right.
Any cross-contamination prevention mechanism has this in mind. So that clean head mechanism minimizes the amount of particles getting into the handpiece. That's right.
Right, and honestly, since we're not right now, flushing between patients because we just don't, and that's more of an end of the day routine, this would be a huge win in just another safety mechanism about really infection control. That's how I would look at that. Is that correct?
That's 100% correct. So in fact, even if you flush the handpieces, as we already discussed, even if you flush the handpieces, the fact is a part of that reverse flow has gone through the tubing, through the exhaust line, into the delivery unit. So you might flush the tubing, but you cannot clean up the whole tray area of the delivery unit. You cannot autoclave it. Even flushing it is not as effective as autoclaving it.
Of course, of course. Okay, so it's a great safety mechanism. Now, does the reverse flow water thing, what we were talking about, that all ties into this, right?
Correct, and that is a complementary system to the clean head mechanism. Clean head mechanism is unique to NSK. That's what we do with NSK. Yeah.
Okay, got it. Is it worth discussing the reverse flow, or have we touched on it enough? I'm asking you.
Oh yeah, I was going to talk about that non-retraction valve, which is complementary system to the clean head. right? So clean head mechanism is related to the airline,
Right.
air reverse flow, and then non-retraction valve, which is present in all of our coupler type handpieces. So one way to say it is like all of our couplers have a non-retraction valve. It's a simple valve, so it allows the flow of water in one direction, and once the water wants to go back into the handpiece, it shuts it down.
Got it.
There is no suck back water. Yeah.
So you have an air no suck back and a water no suck back. That's a double safety mechanism. And that's a double safety mechanism unique to NSK, correct?
Correct. That's
Okay.
100% correct.
Okay. So another interesting part of this discussion, I want to talk about definitely two more things. One is electrics. So I went to electrics. I have multiple electrics in my office, different systems. We have 5 operatories. We don't have air anymore. Once you go electric in one operatory, that's the only operatory you want to work in. But so I'm online and I'm looking, and now there's this whole thing about electrics having less aerosol production, which I think is significant for our viewers to understand, because the United States is still way behind other areas in the world that have gone far more into electrics. I mean, they weigh much less. I mean, electrics have really come really amazingly forward. Talk to me about aerosol talk to me about aerosol and electrics versus air.
Right. I would love to see some universities get into this study and have some more conversations about this. But at this moment, all major handpiece manufacturers have their own evaluations and comparison between air and electric high-speed handpieces.
Right.
But looking into the concept of it, just think about it. When you have air-driven high-speed, you need that high-pressure drive air to run the handpiece. You're thinking of something around 30 to 40 psi drive air getting into the handpiece, into the patient's mouth.
Right.
Whereas for electric, that high air pressure gets into the box first, and that box turns it to an electric mechanism to run the gears. So that's why electric handpieces are called gear driven. So there is no air getting into the handpiece. So this is one of the main reasons that you don't have that high pressure to create that aerosol. The second thing is related to the speed. Like high-speed air-driven handpieces run somewhere from 350 to 400,000 RPM, whereas electric's maximum speed is 200,000 RPM. When the burr rotates at that speed in air-driven handpieces, it creates a huge amount of aerosol and hits the water and creates a splatter and aerosol out there. With electrics, it's much less. You're still going to have some aerosol. It's not zero, but it's much less than the air-driven high speeds.
So Alfred, let's just talk about this, because now my attendees, the people listening to this, are going, what did he just say? Less aerosol. So here we are in this COVID era of who knows how long, and everybody's talking about all these huge suction machines and everything else we have to be doing. But if we switch, and let's just say we're utilizing electrics with good isolation, what you're automatically telling me is we're automatically having less aerosol production because we're using an electric driven handpiece. Is that a good summation point with this?
Definitely, yeah. When you have electric handpieces, because of the same conversation that we had, 2 factors, it's much less, yeah.
What about low speed? What about low speed electrics? Same thing, right?
A very, very good point. With low speeds, I would say the aerosol amount is even much less, because the vast majority of applications of slow speeds don't involve water, and you can turn off the water, and so the amount of aerosol with air-driven or electric slow speeds is going to be much less than high speeds.
So if we use electric slow speeds like I do in my office, now I love water because it's a coolant, but in this COVID time, just to decrease aerosol, and whether it's, let's say, some Carey's excavation or finishing and polishing, whatever we're finishing and polishing, if we we can use electrics without water, obviously. And you're saying overall, we're just going to, again, with slow speed, have decreased aerosol, correct?
That's true. And just as an example, I was discussing this with my friends the other day that more orthodontists have reached out to me for electrics within the past 2 weeks than my entire career, talking about using electric slow speeds, where normally they're not using handpieces that much at all. Like that, they're probably using like one handpiece for like 10, 15 years, 20 years.
Right.
Now they're looking for electric slow speed handpieces because that is enough to remove cement, and you don't need to use water, and you can run it at 40,000 RPM.
Wow, great orthodontic tip and trick. And for pediatrics, because they're using a lot of ortho too. I love that tip and trick also. Okay, now, for my surgeons out there, NSK also, and I know because I have one, we have one that creates, am I right, no aerosol in a high speed. Now, I could be wrong. Do we have a model, like, is it the surgical model that creates no aerosol? You can correct me in front of everybody. What do we got?
Yeah, that's a very good point. So this handpiece is called Z45L. And I want to go one step back. Like a lot of doctors have heard about surgical 45 degree or rear exhaust or impact handpieces,
Right.
that are used for extracting impacted teeth, rear
Right.
molars, because the air exhausts from the back cap. Now,
Right.
Z45L is the electric version of it. And like you said, there's a way to shut down the chip air, turn off the chip air, and there's going to be no air, no drive air, and no chip air getting into the handpiece. So it works like a surgical handpiece without any air, just the water stream coming out of the head. It's electric, and like you said, with all this conversation about electrics having less aerosol, that is the only solution to have a surgical handpiece using with electric system.
But let me ask you this. So if I use this, tell me that what's it called again? The Z what?
Z45L as in Larry.
Okay. So if I use the Z45L, can I, again, I'm just going to ask, can I use this doing restorative preparations in dentistry and minimize my aerosol with that also as an electric? Or is this strictly only for surgical?
Oh, it's a dual system handpiece. So there's a simple screw at the back of the handpiece that you can turn like 180 degree to one direction and have a spray like a normal handpiece.
Yeah.
Or turn it back and have a stream of water like a surgical handpiece. So you can do both within one handpiece when you have an electric micromotor in your office.
Okay.
So if you're comfortable, so let me put it this way. If you are comfortable using a handpiece without a spray, just with the water stream, then yes, this handpiece can do both that surgical part and restorative part.
Okay, wait a second. So this, I should have started with this, sorry. But this is important to me. So let's say I've got to do endo. I've got a patient and they've got throbbing pain. They've got an acute pulpitis. If I use this with a rubber dam on, I will create less aerosol with just the water on without the chip air. Is that what we're saying here?
That's definitely correct, yes. I mean, the amount, chip air is zero when you're turning into the surgical mode with Z45L.
Okay, I think that's a great pearl. I mean that. I just think that's a wonderful. So this could be also used universally in an office beyond just surgery and minimizing aerosol. So let me ask you, and again, I'm not trying to promote just NSK, but is this particular handpiece, like if you go online, do you see how to use it and all, as far as turning all the little things in the back? It's all apparent how to use, correct?
Oh, it's very simple to use. So
Okay.
if you go to our website, which is nsktech-us.com,
Okay.
that's where we have all the operation manuals, and a part of Z45L manual explains how to turn that screw, and the little screwdriver is in the box. It's very simple, and like I said, all the instructions are in the manual and on that website.
Got it. Okay. Last question, and then I'll let you go. Maintenance of these handpieces is, what are we recommending right now?
Oh, yeah. As far as maintenance, we highly recommend lubricating the handpieces before autoclaving it.
Okay.
And with this conversation going about the aerosol, I highly recommend automated machines, because that
Yep.
creates less aerosol and it takes away human error. So there are all good machines in the market
Yes.
for automated mechanism to clean and lubricate the handpiece before bagging and autoclaving, and all FDA approved steam autoclaves are recommended by NSK.
Great. Alfred, thanks so much for all this information. I really, really appreciate your time today. This was a great, really understanding of electrics, lower aerosol, and even more. I look forward to seeing you at the next meeting. Take care, everybody. Be safe and be smart. Have a good day. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.